So you can see we prepared the defects as the medial femoral condyle. And again, we're just going to show how to put the cutter in one more time, our final check. Again, go into the notch, keep the leg at 90 degrees. We're going to check with that cutter. Again, the key here is to see that outer area. It can be hard sometimes to see, so you want to make sure you can see the scope from all the angles. We have our cannula placed in there. This is one of the smaller cutters. And again, we do a slight wiggle of the cutter to make sure we can check all the edges. This is a small hand curette. We're going to clean up the edges to make sure we have nice borders. You can see it's completely enclosed. There is no blowout on any side. And now what we're going to do is dry the knee, taking all the fluid off. We've taken the tourniquet down, and then we're going to make sure there's no active bleeding. There's a little bit of bleeding here, so we're going to use gel thrombin. These are large patties to make them easy to retrieve out of the knee. And again, we're going through the cannula. We've removed the dam from the cannula. We're going to use the V-shuttle again to do a test run. Again, you can sometimes see that it's not a completely perpendicular entry. So here we're going to put some Tacil on here. And now what we're going to do is place the graft. You can see in previous videos the entire technique. And then we're going to use the other tip. Now again, be careful here. You can see even in my situation, I pulled it down a little more than I wanted because the Tacil may not have been fully set. And then you're just going to be really careful. Again, just small touches of this graft. The cell side down now. And then you wait for the 3 minutes, and then you're going to place some more Tacil. Again, it's much harder to go from bottom to top, so you always want to start at the top. And then use the knee to your advantage. Now we've waited 6 minutes total. And we're going to go up and down and check to make sure the graft does not come off. You can see here the graft does not come off with full range of motion, and we're really happy with this. There's the final product. Thank you.
Indication: MACI, autologous cultured chondrocytes on porcine collagen membrane, is an autologous cellularized scaffold product indicated for the repair of single or multiple symptomatic full-thickness cartilage defects of the knee, with or without bone involvement in adults. Limitations of use: effectiveness of MACI in joints other than the knee has not been established. Safety and effectiveness of MACI in patients over the age of 55 years have not been established. Important safety information: MACI is contraindicated in patients with a known history of hypersensitivity to gentamicin, other aminoglycosides, products of porcine or bovine origin, in patients with severe osteoarthritis of the knee, inflammatory arthritis, inflammatory joint disease, or uncorrected congenital blood coagulation disorders, in patients who have undergone prior knee surgery in the past 6 months, excluding surgery to procure a biopsy or a concomitant procedure to prepare the knee for a MACI implant, or in patients unable to cooperate with a physician-prescribed post-surgical rehabilitation program. Malignancy: the risk of MACI in patients with malignancy in the area of cartilage biopsy or implant is unknown. Expansion of malignant or dysplastic cells present in biopsy tissue during manufacture and subsequent implantation may be possible. Transmissible infectious diseases: because patients undergoing procedures associated with MACI are not routinely tested for transmissible infectious diseases, cartilage biopsy and MACI implant may carry risk of transmitting infectious diseases. Presurgical comorbidities: local inflammation or active infection in the bone, joint, and surrounding soft tissue, meniscal pathology, cruciate ligament instability and misalignment should be assessed and treated prior to or concurrent with MACI implantation. Product sterility: final sterility test results are not available at the time of shipping. The most frequently occurring adverse reactions reported for MACI, greater than or equal to 5%, were arthralgia, tendinitis, back pain, joint swelling, and joint effusion. Serious adverse reactions reported for MACI were arthralgia, cartilage injury, meniscus injury, treatment failure, and osteoarthritis. Use of MACI in pediatric patients younger than 18 years of age or in patients over 65 years of age has not been established. The MACI implant is not recommended during pregnancy. For implantations post-pregnancy, the safety of breastfeeding to an infant has not been determined. To report negative side effects, contact Vericel Corporation at 1-800-453-6948 or FDA at 1-800-FDA-1088. 1-800-332-1088 or www.fda.gov/MedWatch. For more information or to view full prescribing information, please go to MACI.com.